Joining us now to do a deeper dive on some of the hurdles our nation continues to face in the battle against COVID is former acting director for the CDC and current president and CEO of the Robert Wood Foundation, Dr. Richard Besser. Doctor, thank you so much for joining us again.
Thanks for having me on, Byron.
The mask debate has gotten a lot of attention this week, with Texas and Mississippi ending mask mandates. And then on the other end, the governor of Alabama has extended their mask mandate, particularly when it comes to a state as large as Texas. How bad can things get, despite the fact that people are slowly getting vaccinated?
Well, you know, it's been so encouraging to see the numbers going down around the country. The numbers going down in states like Texas. But, you know, fewer than 10% of the adults in Texas have been vaccinated. That means that there are a lot of people who are vulnerable, a lot of people who are susceptible to this infection. And, you know, if wearing a mask was simply a matter of a personal decision and personal acceptance of risk, I'd say, fine, get rid of the mask mandates. But when a person decides not to wear a mask, they're not just putting themselves at risk. They're putting people around them at risk. They're putting people at risk who have to go to work each day to put food on the table. And that's just not right. If we hang in there together as a nation for a few more months, we're going to see a lot of the requirements that are being put on people eased, because we're going to be able to get vaccine out to everyone who wants it.
Sure. Doc, according to the latest information from HHS, the 7-day average of cases decreased 2% last week, and it's decreased a whopping 74% since our nation's peak on January 11th. I know you hesitate to make predictions about this wild virus, but how good are you feeling right now about our nation's progress?
You know, I'm cautiously optimistic. You know, the numbers are moving in the right direction, though over the past week they've leveled off, and that gives me a lot of pause, and I think we have to be careful. We have to be careful because of the variants that have been emerging that we know spread so much easier. And while the numbers are looking good, the daily number of cases right now is still higher than what it was last summer when we started to put in all these restrictions. We're still seeing more than 2,000 people in America die each day from this. So while we're moving in the right direction, we have to stay together and follow public health guidance until we are truly done with this pandemic.
Doc, today you authored an op-ed for The Hill titled "COVID Recovery Requires Addressing Economic Inequities." In your article, you encourage Congress to focus on 5 main things in order to give our country the chance to truly become a healthy nation again: housing, nutrition assistance, paid leave, unemployment insurance, and health care access. You've worked at the highest level of government. Inequities in this country have been a constant, particularly for communities of color. What's your biggest concern about our government not having a true moment of reckoning as we slowly start pulling out of this?
You know, what I worry about, Byron, is that we're going to see this as a short-term situation. And once we're out of this pandemic and it's really in the rearview mirror, we're going to lack the national will to make the changes in society so that everyone has the opportunity to lead healthy lives. You know, we've seen how this has played out in the pandemic, where people who have needed to go to work each day to put food on the table, to pay the rent, they've paid a major health cost, and it's not been spread evenly. Black, Latino, Native Americans, lower income communities have been hit the hardest. But if we address these 5 areas, then each day in America, even when we're past a pandemic, will be a day when everyone has the opportunity to lead their healthiest lives. And we have to come together as a nation to do that.
And Doc, we'll get you out of here in this question. The CDC was supposed to release recommendations today on interactions between vaccinated people, but that has now been delayed. What is known about what people can do once they've been vaccinated, and what do you expect the CDC recommendations to show?
Yeah, I mean, this is challenging because there's not a lot of data. We're new to this vaccine. We're new to what science shows can truly happen. But I hope at a minimum they say that a group of people where everyone has been fully vaccinated can get together indoors without masks and spend time together. I hope they say that grandparents who are fully vaccinated can hug their grandchildren. I mean, that would be a wonderful thing, and it would encourage people to get vaccinated. It's going to be a long time before everyone can get vaccinated, but those who are fully vaccinated should be allowed to do more things than they were able to do before.
Dr. Richard Besser, thank you so much for your time. I'll see you down the road.
Take care. Be well.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.